Hey there, my DPC Story listeners. Maryal here. On this election day, I wanted to drop a special collection of interviews I did while lobbying with fellow DPC physicians on Capitol Hill in September. When we were on the Hill in DC, we spoke with staffers, the Senate Finance Committee, and the head of CMMI, and we had the privilege to share our collective stories as we lobbied for bills designed to make quality, affordable, accessible healthcare the standard and not the exception. And in between Senate and House meetings, I was able to capture something special. The voices of these physicians you'll hear, each independent, each fully committed to the mission of putting patients first, speak about ensuring that direct primary care becomes the primary care in this country. We are here, after all, to honor the doctor-patient relationship over the corporate model of medicine, to build a future that places patients at the center of everything we do. And the support we need for this? It's bipartisan. It's built on the shared understanding that healthcare reform starts with listening to those on the front lines. You're about to hear from some of those voices, DPC physicians who came together, stood together, and spoke up for a vision of healthcare that's accessible and patient-centered. So listen up as you hear voices united in our mission to make direct primary care simply primary care. Enjoy. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story Podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Maryal Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
Yeah, this is Garrison Bliss. We're just finishing up at the end of a long week of work on Washington, D.C. This has been, I think, without a doubt, the most productive, fascinating, and successful visits we've made to Washington, D.C. We started out more than 10 years ago trying to keep direct primary care from being assassinated inadvertently or intentionally because of things happening in Washington, D.C. where they had no idea what we were doing. This time around, we encountered what to me is remarkable, which is wherever we go, they not only know what direct primary care is, but they actually understand that this may be the only way to save both primary care and healthcare itself in the United States, at least the only one that's been identified so far, and they sure tried a lot of stuff. So, I mean, we didn't meet with just anybody. We've met with top people in the House and the Senate and the committees that are going to decide whether this thing moves forward. We met with CMMI at Department of Health and Human Services. We met with the head of CMMI, and she's rooting for what we're doing. The question was, how do we do it? Not should we do it or could we do it? So they have their own sort of political issues they have to get around. They have the usual mess that occurs in Washington, D.C., but we're now in the conversation as an independent group that's not going to do what they say. We're asking them to do whatever they do on our terms with agreement of us and our culture, which means that there's a possibility they may even offer something we want to do, because I think lots of us want to take care of Medicare and Medicaid patients without having to be regarded as some kind of problem they have to deal with. So the solution, not the problem. And I think that message is finally getting across.
And why should other people come to the next fly-in?
Because it matters. It matters. I mean, it always mattered, but in the beginning, you're trying to bend an immovable object that will require more strength than you could possibly manage. Now we're dealing with a situation where they are looking for solutions. The healthcare issues are getting worse, not better in the United States. And I think that both parties recognize that if they don't come up with solutions pretty soon, then they may all be out of jobs. So I think that they're honestly looking, and they don't know where to look except here. When I got to Health Rosetta, I realized that this movement has taken a gigantic leap. So if you want to find out what's going on in the United States, that's not just direct primary care, that's actually rebuilding an alternative medical universe that will compete directly with the mess in Washington, D.C., you should come.
I'm Dr. Sara Pastoor. I'm a family physician in San Antonio, Texas. I practice in the direct primary care, and I cannot believe that I'm in our nation's capital on 9/11 speaking to members of Congress about two DPC bills. One is the Primary Care Enhancement Act that would make it legal for patients who have an HSA plan to seek a DPC doctor and pay for that out of their HSAs. And the other one is the Medicaid Primary Care Enhancement Act, which would allow states to work with CMS to let Medicaid patients choose their own DPC doctor and pay for that through Medicaid. And so I've just left Representative Chip Roy's office. I'm his constituent. He's my representative, and met with his staffer to talk about these two bills. They're very supportive. Representative Roy is a Republican in Texas, and he's very pro-DPC. I think the thing that struck him the most was the concept of financial advocacy, which is unique to DPC. People don't know how much healthcare should cost, and there's a lot of surprise bills, and it is driving a lot of financial debt. And so he was very impressed with the idea that we really help patients navigate that financial landscape in healthcare. He also was very impressed with the idea that while DPC doctors may make sometimes a little less money, usually about the same, but sometimes a little less money than they were making in the insurance-based system, they're so much happier. And that this is the only path, really, to rescue primary care in this country. And he was very impressed with that notion as well. So overall, it was a great meeting, very supportive. He was very knowledgeable about DPC and primary care, and so I feel good about it.
What would you say to those people to encourage them to come to the next DPC Coalition fly-in?
This is my first time doing this, and I think the important thing to remember is that we can't just assume that things are going to go our way. We have to show up and advocate for it. We have to show up in force and say, this is what the people want, and so really make our voices heard. These bills have been percolating for years. We finally have bipartisan momentum. There's no reason that this should not be passed, and we're really here to apply pressure to them to say, get this done. It is a win-win for everyone. And so that's why I'm here.
Hello, my name is Jeannine Rodems. I am a family physician. I founded Direct Primary Care in Santa Cruz, or Santa Cruz Direct Primary Care. I'm here in Washington, D.C., promoting legislation that's hopefully will support our model of care to be promoted both on the Medicare and HSA and Medicaid groups of patients. We just left Representative Panetta's office, who is a Democrat from Monterey County, and his staff are very supportive of our movement. So I wish more of you would actually come and visit with your legislators and promote this cultural movement of direct primary care.
In the meeting, what was it that people found helpful to hear?
The staff at Panetta's office were really interested in looking to a better solution for primary care, with the understanding that there are a lot of difficulties in shortages of primary care in our community, access to care, especially for Medicaid and Medicare patients, and difficulty with costs. They were interested in a little more detail of the business model of direct primary care, which I think we surprised them with, how efficient we function and how much cost reduction we are able to provide with performing full spectrum primary care services.
Hi, I'm Ricky Haug. I'm a DPC doc. I started a practice outside Philadelphia in 2016. We have another location now and 5 docs, and it's been really exciting to see the years of growth and just how much DPC's grown across the country. And I will say that this lobbying session, I've done this a few times now over the years, actually went in 2016. And even just in the short time period from February to this session, it's been really exciting to see how engaged the staffers were. And some of them actually had already talked to somebody else about the bills. They had questions written before they even got into the room. It was a much different experience, and I just think that the interest is there and the momentum's there for something to be done. I think that we've had so many barriers in the healthcare system. The healthcare system's not working for most patients across the country. I think the representatives haven't had a lot of wins, and when you have a bipartisan bill that's going to provide more affordable, accessible health care, improved patient satisfaction care, and decrease downstream costs, it's a no-brainer, and I think they're realizing that, and it's so fun to be part of the movement. I think we need to continue to hit the hill and just let everybody know, like, hey, we're here to stay. Like, we're going to change this system, and we want you to jump on board. And I think the growth across the country has just been amazing. And the more people that we can get to show their senators and congressmen the importance of this and the impacts that they're making on their individual communities, the better.
I'm James Gaor. I am a physician practicing in Irvine, Halcyon Health Direct Primary Care. So what we did today on the Hill was really fascinating. The last time we did this was in 2017, so this was 7 years ago. And I think really the reception from the staffers was quite different compared to 7 years ago. One being, I think there was a lot more questions from the staffers really engaging us and asking, how does this affect access to Medicaid patients, Medicare patients, really trying to get a really better understanding of how DPC can work for patients with insurance, both government-sponsored as well as private insurance, and a real earnest interest in how DPC could be a viable alternative to the current system to really provide better quality care for their patients, and also understanding the fact that physicians really need a different way of practicing primary care to be far more effective. So it's such a great opportunity to be part of that, and also seeing the gap between 2017 and 2024, the culture shift in terms of inquiry from staffers and understanding what direct primary care is, now seeing how the pain points of various Medicare Advantage plans, how Medicaid is implemented specifically in California, and really now wanting to try to understand how solutions could be implemented, and knowing that direct primary care has had such an interesting foothold over the past 10 years or so. So super fascinated and interested to be a part of it, and definitely will be part of the next fly-in, and such a great opportunity.
My name is Paul Yerkes. I'm at Core Family Practice, just south of Philadelphia. This is my second time with the DPC Coalition. Met with a bunch of aides from some senators in our nearby states. The vibe this time was completely different. We had some aides who knew we were coming. They would talk to the previous individuals we spoke with, so they were aware of DPC, they were aware of what we're trying to get passed here, and they were very receptive to what we're trying to do. Everyone wants to make a change in healthcare, and having physicians that can come down here and express how passionate we are about this and how passionate we are about taking care of patients, and that there are barriers in the way that we need to change so that we can take care of more patients, that really resonated with them. So I'm going to keep coming down as often as possible, and the more physicians we can get down here on the Hill that can relay this message, the better.
We are here in DC at the steering committee meeting, and so I wanted to just get your stance on how successful we could be this legislative session, or even if there's a lame duck session, to get the HSA bill passed.
I'm as optimistic as I usually am. I guess I'd lean 51%, I guess, puts it in the optimistic side. We've been pushing this rock up a hill for 10 plus years, and I think that there's more and more bipartisan interest. And I think we're mostly not fighting genuine opposition. We're mostly fighting ignorance. And the people that are opposed, when you ask them why, their comments demonstrate that ignorance. It's rare, genuine opposition.
And it's so true, and I think that this is why it's so important that we do keep telling our stories, because we're in a different place than we were 10 years ago.
I agree.
Learn how you can get involved and help advocate for the DPC movement within your state and on Capitol Hill. On the blog accompanying this podcast at mydpcstory.com, you can find the video of Jay Keese of the DPC Coalition and I speaking at this year's HINT Summit in more detail about the updates on Capitol Hill when it comes to DPC. You can also find the link there for the DPC Coalition, where you can find resources to help you advocate on the local, state level, or at the next fly-in. Thank you for joining us for another episode of My DPC Story, highlighting the physician experience in the world of direct primary care. I hope you found today's conversation insightful and inspiring. If you want to dive deeper into the direct primary care movement, consider joining our My DPC Story Patreon community. Here, you'll have access to exclusive content, including more interview topics and much more. Don't forget to subscribe to My DPC Story on your podcast feed and follow us on social media as well. If you're able, I'd greatly appreciate if you could leave us a review. It helps others to find the podcast. Until next time, stay informed, stay healthy, and keep advocating for DPC. Read more about DPC news on the daily at dpcnews.com. Until next week, this is Maryal Concepcion.